10th, 2021, Cumberland County Commissioners Workshop Meeting. If you would, please stand and join me for the Pledge of Allegiance. I say, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I call this meeting to order at 9 a.m. and at this time I open up the floor to public comments.
Nobody is on.
Hearing none and seeing none, we'll move on then to agenda item number 3. And I will call on Caitlin to discuss the amendment to the Emergency Solutions Grant. Caitlin?
Yes, so we put in a resolution to have an additional $53,626 added to the CV1, the ESG CV1 contract. This is for emergency shelter operations and case management at Safe Harbor. And then this is in addition to the other amendment that we had presented previously and was accepted. So now our new contract total will be $218,638.
Commissioners, do you have any questions for me? No. And I'm sorry, Caitlin, please tell me your last name.
It's Cluck, C-L-U-C-K.
Thank you.
Yep.
All right, we'll move on then to agenda item number 4. And I'll call on Dana Best to discuss resolution 2021-27 regarding a budget adjustment. Dana?
Good morning. There I am. The 911 fund is increasing revenue and expenses by $1,500,000 to cover the current expenses related to the P25 radio project. This will occur before we secure the bond. The expenses are uniform eligible, so we would like to run the subsidy through the 911 fund so that the expenses are appropriately charged there. And ultimately, it will result in a general fund subsidy to the 911 fund. The nursing home is increasing expenses by $3,700,000. This is to cover the transfer of ownership consulting agreement entered into in July of 21, outsourcing of the nursing home administrator starting on September of 21, increase in the temporary nursing personnel to staff transitions, and also a transfer of funds to the general fund. On the other side of this entry is fund balance because we're not increasing revenues. However, there are additional revenues in the nursing home because the bed days are down from 260. They were budgeted at 269 and they've been running about 150 to 160. Are there any additional questions?
Yeah, I'm sorry, Dana. I couldn't tell if you said if you said increasing or decreasing revenues because of bed days.
Oh, the revenue is decreased, but there's enough budgeted revenue to cover the IGT.
Thanks.
Sorry.
That's okay. I think it's just the system this morning.
Yeah. Dana, I have one or two questions. You mentions here in the written one that is about if nursing personnel to staff transitions. Is that capital T transitions, the facility, or is that generic?
It should be a capital T.
Okay, all right. And could you very quickly explain what that means when it refers to a transfer of funds to the general fund?
That is the money that the nursing home is repaying for the IGT. And we may come back next hearing for a resolution to the general fund, but there were a couple of outstanding items that we didn't want to do a resolution and then not need the money. But I think we're going to be back for that for the IGT. For the general fund.
That's great. That's great. I just wanted to state it in clarity. So thank you.
And Dana, what is the total amount of consulting services that we have paid thus far?
So far, it is $167,000. And we did estimate that line item high because we'll be transferring money out of that line into other areas as needed. We just don't know where it's needed yet.
And so when you say so far, and I'm assuming by so far you mean as of today, we've spent $167,000 on consulting services, and that is Alair's consulting agreements? Does that also include the nursing home administrator, or is it just the consulting agreement?
It's both.
Okay. Okay, thank you.
So it's
You're
consulting and services. Consulting and services.
Yes.
I can tell you, having come from that field, a lot of people think when you say consulting, somebody's sitting in an office just spewing opinions. It's not that at all. There's a lot of work involved.
Mhm.
So we tend to refer to it as consulting and services. Thank you.
You're welcome.
Any additional questions for Dana? All right, thank you, Dana.
Thank you.
We'll move on then to agenda item number 5, and I'll call on Tammy Hershey for contracts and grants.
Thank you, Stacy. Agenda item number 5, numeral 1, is existing contracts, contract extensions or addenda with no additional cost or increase to the county for juvenile probation. Commissioners, do you have any questions, comments, or concerns regarding this agreement? Hearing none, we will move on to agenda item number 5, numeral 2, A through F, which consists of new contracts, vendors, services, grants, and contracts with increases or decreases to the county. I'll begin by calling on Kim Bittner to discuss the contract for aging and community services. Kim?
Good morning. This is for Salvation Army. It's an amendment to the 2020-2021 fiscal year, and it is for providing senior center services, and we're increasing it by $5,000.
Questions for Kim? Thank you, Kim.
Thank you.
Next, I'll call on Jamie Ryber to discuss the contracts for children and youth. Jamie?
Good morning, Commissioners. The first one I have is Presley Ridge. They provide both foster care services and in-home parenting services. They are adding a new level of foster care this year and requesting increases ranging from 0.42% to 5% for their other 3 levels of foster care. They're also requesting a 3.41% in their parenting services. They have increased visits and supports to foster families. They've increased their employee salaries and trainings for staff and foster families to receive trainings on things such as cultural diversity, family engagement, and trauma-informed care, as well as implemented enhanced assessments for complex youth. The next contract is for Catholic Charities of the Diocese of Harrisburg, Pennsylvania. We previously contracted with them, but have not for quite some time. And due to the fact that we need lots of foster homes, we are reinstating a contract with them. Their rates are all comparable to all of our other foster care programs and are within the maximum allowable. The next 2 are Summit Schools Incorporated, doing business as Summit Academy, and Community Specialist Corporation, doing business as The Academy. They fall under the same umbrella. The Summit School is actually for females, and the Academy is for the males. Summit is requesting increases in 8.55% to their residential, going from $208.20 a day to $226 a day, 3% to their drug and alcohol program, 3% to their shelter program, and 3% to their specialized settings program. Their increases are due to salary and benefits, rising utility expenses, increasing consulting fees and administrative time due to mandates, additional training opportunities, and upgrade to their facilities to ensure comfort and safety to their clients and staff. The Academy is requesting increases, 10.04% increase to their residential program, 10.68% to their drug and alcohol program, and 9.7% to their shelter program. They are also adding a specialized setting program to their level this year on that campus. And their reasonings are pretty much the same as Summit Schools, because like I said, they are governed by the same company, and one's just for males and one's for females. Are there any questions?
Thank you, Jamie.
Thank you.
Next, I'll call on Dana Betts to discuss the CNRC contract. And Commissioners, this is an action requested item. Dana?
This contract is the agreement with the Department of Human Services, Office of Long-Term Living for the county IGT payment of $2,386,324. The state is offering a 6-month agreement due to the potential transfer of ownership. So this agreement is for the time period of July 1st through December 31st. They have also amended the payment timeframe. The payment is due to the state on 12/22 instead of having to wait until May. And the estimated payments from the MCOs to the nursing home are over $4 million through the end of December. Are there any questions?
Yeah, I have two, Dana. The first one is, so the payment is due on 12/22. It covers it's a 6-month agreement, anticipating a transfer of the nursing home. What if the nursing home were to somehow transfer by the end of November? Does this amount change?
The amount that we pay to the state does not change, but the amount that we will receive will change. We will receive the money to the nursing home based on when the state transfers the money to the MCO. So any monies that have been transferred as of the date of the transfer of ownership will be due to the county. So for example, the October payment is transferred to the MCOs on November 15th. We'll receive that payment because we're not going to transfer ownership before November 15th. If we would transfer ownership on December 31st, we would also receive the one that's made on December 15th. We are estimating that we will more than break even. The break even payment is the one on the 15th. That then we exceed the $2,386,000.
Okay, and that's my concern, is that we're going to pay this money in and not get back what we should be getting back.
We will at a
Depending on the
minimum
date of
break
closing.
even.
Okay,
Correct.
all right.
And just to add to that, we did a lot of number crunching to ensure that this was the best option.
Okay, well, that's good.
Yes.
And then, Dana, what happens if we don't do this?
We would not receive we would owe back the money that we've received from the MCOs. And so we wouldn't earn that extra money.
Okay, so the IGT is critical to the
Yes.
finances of the nursing home. Okay, thank you.
Absolutely.
Any other
Any
questions?
additional questions?
No.
No. Thank you, Dana.
Thank you. And it is
Motion,
action
yes.
requested, please.
Yeah, so if does anybody have additional questions before we call the, well, entertain a motion for action?
The motion would be trying to figure this out. All right, I'll make a motion to accept the request for approval of the IGT 6-month agreement, July 1, 2021 through 12/31/2021. New contract amount of $2,386,324.
And I'm going to second that motion.
Okay, it was moved and seconded. If there are no further questions, all in favor indicate by saying aye.
Aye.
Motion carries.
Thank you.
Okay, thank you.
Thank you. I'll now call on Holly Sherman to discuss the contract for human resources. Holly.
Good morning, Commissioners. This contract is with BHS. They are our wellness provider, but this contract is for our employee assistance program. We are moving from our current provider to BHS. The benefits of doing that is the employee sessions will increase from 3 to 6. Additional training for supervisors and department heads, access to free resources and tools via the online portal, and additional providers within the area for the employee assistance program. This is an increase over 3 years of $2,400 from our current provider.
Questions for Holly?
This applies to all departments equally then?
Yes, it does.
Okay, thank you.
Thank you.
Thank you, Holly. I'll now call on Sue Carbo to discuss the contracts for MHIDD. Sue?
Yes, good morning. So the first three contracts are early intervention contracts. The first one is for Barbara Weber. It is an amendment to her fiscal year 21-22 contract for an increase of $5,876 for additional speech therapy services. For Stacy Foreman, her contract is also an amendment to her fiscal year 21-22 contract for an increase of $17,826 for additional speech therapy services. And for Jenna Vandervelden, this is an amendment to her fiscal year 21-22 contract for an increase of $17,864 for additional physical therapy services. The next two contracts are mental health contracts. The Diacon Child, Family, and Community Ministries, doing business as Diacon Family Life Services, is a new renewal contract for fiscal year 21-22. It's a decrease of $2,000 from last year, the contract total being $5,000 for outpatient therapy services. For Aurora's social rehabilitation services, this is an amendment to their fiscal year 21-22 contract. It is an increase of $63,524 for additional services and the extension of the contract to June 30th. And these services are social rehabilitation services. The last two contracts are intellectual and developmental disability contracts. The first one, Alliance for Nonprofit Resources, is a new contract for fiscal year 21-22. It will be in the amount of $13,000, and it is to force them to conduct the certified investigations that we are required to do per our oversight agency in Harrisburg. And the last contract is Aurora Social Rehabilitation Services again, and it's amendment to their fiscal year 21-22 contract for an increase of $16,090. It is for additional services and the extension of their contract to June 30th of 2022. And it is for the social rehab, recreational leisure time activity services that they provide. Does anybody have any questions? All right, thank you.
Thank you, Sue. I will call on Claudia Gardner to discuss the contract for public safety. Claudia?
Good morning, everyone. Public Safety is seeking your approval to expand our current services with On the Job and Off, which is a locally owned licensed professional behavioral health specialists that serve first responders on a nationwide platform. Currently, we have an annual membership for each of our staff that provides them access to the online platform, giving high quality training sessions that covers topics such as vicarious trauma, post-traumatic stress, grief for first responders, the effects of a bad call, and many, many more. These are specifically geared toward first responders, and there is a track specified for dispatchers. We'd like to take that one step further over the next year and engage with a contract with On the Job and Off that has 3 tiers. The first tier being the continued annual membership that I just described for all of our staff. The second tier would be an assessment and reporting phase. On the Job and Off partners with Data Science Corps at the Innovations Corporation. They'll administer and evaluate a survey that each dispatcher would fill out and then take it and put it through all of the statisticians and clinicians and experts that will be able to provide back a report establishing basically a benchmark for the behavioral health of the employee. Those survey results would be shared with that person, and then a follow-up survey would be asked in 6 months and at the 1-year mark. And then we'll compare. So, if If Sally was getting 8 hours of sleep when she first started at 911 and 6 months later, she's only getting 3 hours of sleep, that's an identifiable change that we can address and hopefully be more on the preventative phase. The third tier is the assistance level. And basically what this is, it will be a service made available to all first responders in Cumberland County by way of our critical incident stress management team that we've come to know and trust. Once a first responder has gone through the CISM team member, and that member has deemed that it is necessary to activate the next level of clinical service, they would be able to provide the individual with a Cumberland County specific code number to use as a referral into what we're calling the First Responder Assistance Program, known as FRAP. On the job and off, contracted with Living Forward LLC out of Camp Hill, and they are providing 6 to 8 clinicians currently and educating even more, who will be available on a 24/7 basis and have experience and certified to ensure that they're culturally competent to effectively work with and help our first responders, our dispatchers, and all of the first responders in Cumberland County. The contract will secure 300 hours over a 5-year period, whichever comes first. And if we would happen to exceed 300 hours of clinical consultation before that time frame is up, we can purchase additional hours. And through this contract, the hourly rates would be locked in at $100 per hour so that we can minimize the risk of inflation impact over the life of the contract. Comparative rates in our region would be anywhere from $300 to $500 an hour. And the contract clinicians are passionate about serving the first responders of Cumberland County, so they are all on board with this. With that, we will receive quarterly reports, obviously not identifying the individual, but it will identify the number of hours utilized and by which discipline, so that we can better gauge and make sure that we have enough clinicians on board skilled in those specific areas. And we can also judge our return on investment, obviously. The FRAP program offers 10 sessions per person over the calendar year. If an individual would need more than those sessions, they would be judged on a case-by-case basis. And the next step would be their personal insurance before any out-of-pocket expenses are incurred. Sorry, tongue's twisted. FRAP is connected both in and outpatient first responder, specific mental health and drug rehab centers. Therefore, going through this process will basically give unquestioned access to the resources that any of our staff or first responders in Cumberland County would need. In terms of how does this compare to our EAP program that Holly just talked about, we had a conversation with Holly, and this type of counseling service is specifically geared toward our industry. So if someone is having some issues at home, perhaps, and they would be referred to the EAP program. But if it's more specific to a bad call that they had and that they've experienced trauma through that, that's where they would go through the CISM route and then access to this FRAP program. So it'd be very specific to the job. As far as return on investment, as you all know and agree that our greatest asset is our staff, and investing in their mental health and wellness in this way will prove invaluable not only for them and our department, but also for the community that we serve. And just to share with you, one of our staff members gave us permission to share this quote from him. Get it specifically. He said, "I was connected with a counselor from On the Job and Off First Responder Assistance Program at a time when I really needed help. My grief included anger, irritability, breakdowns, and sleeplessness. I wasn't able to do some of my normal activities. I know now that reaching out for help does not make you weak. It takes a lot of courage to tell someone that you don't know how to handle what you're going through. I want other first responders to know and have access that they can ask for help, and the help that I got was exactly what I needed." The contract in terms of pricing for the different tiers, tier 1, the educational piece that we talked about, the annual membership renewal, because we will be engaging in the additional 2 tiers, On the Job and Off is comping that educational piece. Tier 2, the assessment and reporting tool that we talked about, is a total of 9,320. And tier 3, the first responders assistance program, is 40,000 over the next 5 years. And again, we talked about that, guarantees 300 hours. And if we go above and beyond what that price point would be. So over the 5-year total, we're looking at $49,320. I'd be happy to answer any questions if I can, or engage in more conversation.
I'd say it's a bargain.
I agree.
Any questions for Claudia?
So,
All right, thank you, Claudia.
Thank you, everyone.
That completes the contracts. I'll now turn the meeting back over to Susan.
Thank you. Moving on then to agenda item number 6, it's Commissioner's Liaison reports, and I'll start with Commissioner Eichelberger.
okay, just briefly, Friday is our Workforce Investment Board Regional South Central PA Works meeting. We'll get some more information, I believe, on the SEDS program that Jesse McCree was in and briefed us on. And in a similar vein, I did meet with Kentucky, the head of our task force for CADIC on workforce development. Met with him last week, and he's moving very aggressively on program design. We had a panel of the task force to take us to the next steps on the workforce issue, especially in light of our transition in staffing on that. So it was a very interesting meeting. I did provide a written summary to both my colleagues. So if there's any questions on that, feel free to send me an email. I'll be happy to answer those. I'm very confident that that's moving in a nice direction, a very different direction. But we're very fortunate to have Ken available as a resource, as well as Jesse McCree at South Central PA Works. In a similar vein, also just let's see, CCAP. We all, I think, got our requests regarding appointments. If for whatever committee you're interested in, just a reminder that those need to go back if you want to be appointed to whatever committee you might be assigned to, or if you want to make a change. That I don't know the deadline. They like to get those back pretty promptly, and it is competitive with some of the committees, so it's just worth mentioning it. Prompt return is advisable in some cases.
I think the deadline is the 12th.
Okay. All right.
But
Thank
what
you.
came to me,
That was-
I'm pretty sure it said to get all that information back by the 12th.
Okay, I know, and that's, in the past, it's been kind of a soft deadline, but we don't want to say that out loud. So we want people to
Well,
comply
you did.
with it. Exactly. So, okay, that's helpful. Thank you. So the 12th. And let's see. For CADIC, also just, again, significant involvement right now, both on the staff assessment study as part of the group that's essentially steering that, as well as some involvement in the screening committee for the positions that are out for recruitment right now. So I'll have more to report on those soon. That's it.
All right, thank you, Commissioner. Commissioner Fauci.
So the Children and Youth Citizens Advisory Committee, I'm on a subcommittee of that group, and it is a legislative and policy committee. And we met earlier, I think it was Monday evening we met. And so we have reached out to Representative Delozier, as she is the majority chair of the House Children and Youth Committee, to see if we can get a meeting between Rep. Delozier and Nikki McElwee to talk about some of our most difficult cases in the children and youth system. So I am feeling confident that that will work out, that we'll be able to get an audience with her. Last night I went to CADIC's event at AHAC, the elected officials reception, and boy, it was great. It was with our military representatives. There was a great conversation about how important the military is to the Commonwealth of Pennsylvania, how great it would be to get DC to move some more installations to PA, and what a driver the military is of the Pennsylvania economy. So that was certainly well worth the time to go and talk with everyone. And that's all I have today.
All right, Stacey. Thank you, Commissioner. Commissioner DiFilippo.
Yes, the County Ag Board met this morning. Nothing really outstanding to report. 2020 farms have settled. All of the 2021 farm selections, with the exception of one, have accepted offers. So they're moving in the right direction. But I also want to point out our member at large, Kyle Kostmeyer, has resigned. So we are looking now for a new at-large member, and that search has already begun. So if anybody knows anyone who might be interested, they can contact Stephanie Williams. But I had to leave the meeting early, but I want to announce something that's very exciting, and I think we really need to jump on this. The PA Dairymen's Association is looking to construct a PA Ag Discovery Center, and they have narrowed their location to 4 counties: Adams, Cumberland, Dauphin, and Lancaster County. I have some handouts here for my colleagues and you and for Stacy too as well, but I just want to read this just a little bit. It's construction of a destination aimed at educating consumers about Pennsylvania agriculture and inspiring the next generation of farmers, while offering interactive entertainment and education in a fun, family-friendly environment. The Dairymen's Association, in partnership with the Center for Dairy Excellence Foundation of Pennsylvania, is spearheading an effort to cultivate and inspire the next generation of farmers, as well as highlight the farming industry's critical role in the state's economy through increased education and agritourism opportunities. And to achieve this, the partnership is proposing the development of the PA Ag Discovery Center. Kirk Stoner and Stephanie Williams will be giving us a more in-depth presentation soon about this opportunity, and I think it's one we should really, really consider. This would be really a gem to have here in Cumberland County. I have 3 handouts here for Gary, Gene, and Stacy. This is really technically hot off the press. I don't have a great deal of info yet, but this executive summary is very good.
Commissioner, I would like to point out, Kirk has shared this with me.
Okay.
He wanted to talk about it.
Okay.
The one thing, the most exciting part of this that you did not mention is the live dairy cow birthing center. So that
yeah,
people will be able to see dairy cows being birthed. I thought that was fascinating.
Yeah.
Maybe not for everybody.
I think that's super cool. Vince, may I ask a question?
Yes, please.
So what do we need to do as Cumberland County to really let the Dairymen's Association know that we would like to have this here? What a great project to have right here in Cumberland County.
Well, obviously, the location of it would be critical. I don't know if we need to establish some type of committee, whether this could be handled through Kirk or through Stephanie. But, they've narrowed it down to 4 counties. And again, this is just so new, the information received. But I don't know if it would help going through our state, federal folks or not. But maybe that's something we can discuss when or pass along to Kirk to get his ideas. But yeah, this is an opportunity I think we can't let it slip away.
I'm meeting with him today.
Okay, good. Oh, yeah, no, it sounds fantastic.
Okay. All right, moving on to some other things. The CapCog will meet on Monday evening. Bob Shively and Brian Hamilton will be in attendance. They will be giving a presentation on P25, our radio project. And tomorrow, Veterans Day, I'll be attending an event at AHEC. And that's all I have, Stacy.
Thank you, Commissioner.
Mm-hmm.
I would like to report, we had an executive session on November 9th, 2021 at 9:30 a.m. regarding personnel. Is there any other business to come before the board today?
Just a couple things, if I may. This is nothing new or surprising, but yesterday on I-81, another classic example of the mess this is and how it's affecting not just Cumberland County, but anyone in that corridor. And with the recent passage of the federal infrastructure bill, I think we as a board really need to get after PennDOT, our federal representatives as well, to make sure that this area in Cumberland County is given some priority. And the amount of money in this infrastructure bill should be a no-brainer, in my opinion, that would at least address I-81. So I would just ask my colleagues if we can do something. I don't even know what specifically, but this has been kicked down the road. The can has been kicked down the road for many years. Now we have the money, I hope, to do this. The second item I want to just mention, and I know it's Stacy, you and John Love, I guess, are talking about this. Maybe too, it's now time to look at constructing a new county complex. I think we've been doing very well over the years, but as this county continues to grow, I think it might be time to seriously look into the feasibility of maybe a central location somewhere for most of our county employees. That's all I wanted to mention.
So last night at AHEC, Vince, that was, I-81 was a subject of discussion. You know, there's Representative Perry there.
Mm-hmm.
And I think one of the things that I talked about with several people was the fact that, and I'm going to consider this to be a fact, that, you know, we do not have a delegation that is moving money to this area. So I am fully in support of lighting some fire to move that money from the federal government into the state so that we can get 81 under control, and get those exits under control and make things a lot safer. I saw that picture on the front of the Sentinel this morning of that automobile that was in that accident yesterday. It's just unbelievable. It's just terrifying that goes on all the time on 81. So I am certainly in support of that, and I am certainly think that it is time to look at building a new location for county governments, because we have certainly outgrown this building. I hear all the time, Stacy, I think about when you say we're a third-class county, right? It's time for us to really step up and behave as a third-class county and certainly have that appearance. So I'm in favor of that. And I will reiterate again my concern about the Bureau of Elections and the building that they're in, and how we need a permanent solution to the lack of space there. So thank you, Commissioner. Thanks.
Any additional topics to come before the board today? All right, we are adjourned.